Hello and welcome to Dr. Nora's Clinic. As some of you may know, I'm a non-surgical injectables trainer teaching cosmetic injectables to doctors, nurses and dentists all around Australia from Melbourne to Sydney to Brisbane. And in this series of videos, I'll be sharing with you some safe techniques for injecting anti-wrinkle and dermal fillers. All surgical procedures carry risks and complications, and this is no different to cosmetic injectables as well, where the complications can be as severe as blindness. So therefore it is really important that you guys go to a fully accredited course to learn your cosmetic injectables training.
Here's a sneak peek of Ash's before and after pictures. On the left you can see his before picture and on the right his after, and as you can see his frontalis muscle no longer has those strong dynamic lines that we saw before. Moving on to his frown, his before picture he looked pretty angry, and on the right he doesn't look so angry anymore. That's fantastic. Alright, let's get back to anatomy.
So what we're going to do first up is talk a little bit about anatomy, because let's face it, if you're going to be injecting into someone's face, you definitely need to know where you're going to be injecting, because you won't know what you're doing otherwise, and it's really important for you to know where the muscles are. As you can see from this descriptive figure over here, there are a lot of muscles on the face. So whenever you're about to touch someone's face, it's really important for you to know what that muscle is that you're about to inject, what it does, where it goes, and what would happen if you injected in the wrong area of that muscle, which therein lies where we have the risks and complications. So hopefully we're going to go through some anatomy just now with the upper face, and I'll show you some techniques that you can do to avoid those nasty complications that we'll discuss as well. So let's first up look at the forehead. The forehead itself is made up of a muscle called the frontalis. Now the frontalis is a very thin muscle that covers the forehead, and essentially the action of that muscle is to help lift up the forehead. Ash, do you mind give us a lovely look at that? So as you can see, Ash has got quite a strong frontalis. You can see that he's got those dynamic lines. Dynamic lines are the lines that come up on expression when he relaxes for us. He has got some very faint static lines. Static lines are the lines that are there without any expression. Now when it comes to anti-wrinkle injections, you want to target those dynamic lines and stop them from becoming static lines, because treating static lines can be a lot harder in the future. So this is a perfect example of when to have anti-wrinkle treatment to prevent those deep static lines from occurring. Lovely, just raise your eyebrows again. Perfect. So I'm just going to mark on where the frontalis is. Now as you can see over here, on this model here, you can see that you've got your frontalis, and lateral to that you've got a muscle called your temporalis, which is the muscle that also helps us with chewing. So Ash, raise your eyebrows up for us. And just looking towards me. Beautiful. So here we have quite a large muscle, and over here we've got the temporalis muscle on either side. Now we don't want to be injecting into the temporalis because it's not going to, one, have any impact on those forehead lines that we can see, and it may actually impact your chewing muscles as well, as you use your temporalis and your masseter muscles to chew. So that's a no-no. Alrighty, so now that we've got a nice area over here, we can then see whereabouts these dynamic lines are situated. Now, according to the anti-wrinkle guidelines, there are a limited number of units that you need to use in this area. Now, it does depend on which product you're using, so I'd always recommend referring to the product information guidelines for this. For Ash today, I'll be using 12 units of anti-wrinkle treatment spread along the forehead in a staggered fashion in order to capture all of those dynamic lines. It's really important to note that with all of your anti-wrinkle treatments, they do have a diffusion rate. Now this does depend on which product you're using. The product that I'll be using today has a 1 centimetre diffusion rate, which means that if I was to inject Ash over here, I must then be aware that it's going to cause a 1 centimetre diffusion around that area, which means that I don't need to inject any closer than that on the next point, because I'll have another 1 centimetre, as you can see. So that then allows you to space out your injections nice and uniformly across the forehead. Now it's really important to be aware of risks, and there are quite a few possible risks that you can encounter when you're injecting into the frontalis or the forehead muscle. If you're injecting really too low, you can actually end up with your patients complaining of having quite a heaviness on their forehead. If you're putting too much of a concentration of product too low, it will feel heavy, and they'll always feel like they want to open their eyes. And that's because the frontalis itself, when it's inactive, it does actually cause an uplifting effect. However, if you put it too low, it does feel quite heavy, and it causes a lot of depression onto your eyebrows. Now the other issue, if you inject too low on the frontalis muscle, you can actually interact with other muscles. So if, for example, I inject over here, I may end up then causing a diffusion of product into the surrounding muscle, which then may actually lead to a brow ptosis or a brow dropping, which is not desirable in patients. Now again, this can happen. These are risks that you do need to inform your patients of, but if this were to happen, reassure your patient that all anti-wrinkle treatments are only temporary. They only last, say, 3 to 5 months in total, so they will get their brow back to normal again. But it is important to know where to inject and where not to inject. Now, one of the other common complications that can happen when you're injecting somebody's forehead is, for example, something called spock lines. So as we can see here, Ash has a few lines over here, which, raise your eyebrows up again, yeah. If we don't inject a small amount over here and we inject the rest of his forehead, what we'll end up seeing is that the forehead is nice and clear and there'll be no movement at all. But you'll start to see some flickering off of these sort of tail ends of your brows, and the patient will come back to you and say, well, doc, or nurse, or whoever you are, you know, this area looks great, but I can just see my eyebrow tailing off here and I can see this line. And that's probably because they've had that movement there in the past, but because we haven't done a full facial analysis and you haven't injected a small amount of product there, they will still end up flicking that bit up. So if you do want a nice complete picture, you do need to make sure you do a full complete facial analysis, having a look whilst they're talking as well. Where do their eyebrows go? What's flicking up? What's flaring up? Because you need to take a mental picture of that and then make sure that you inject a small amount of product just to allay that and to stop it from moving in future. Because the worst thing is patients coming back in 2 weeks saying, oh, I've noticed this line here and this line here wasn't there before. It probably was there before, but because everything else has stopped moving, they'll notice that more. And trust me, patients, as soon as they've had anti-wrinkle treatment, they'll look in the mirror in the first sort of minute of having anti-wrinkle treatment, they'll start looking at, where's my movement? Why is it not working so far? And we have about an 8-second memory of what we look like ourselves. So we're going to forget what we look like. And I don't know if you guys have ever had anti-wrinkle yourself, but you'll be literally looking in the mirror every day, waiting and looking, and you'll be seeing when is it going to start working. So patients after anti-wrinkle treatment are the most critical people, and I'm the same. I've absolutely done the same myself. So it's really important to be aware of all of these little tips and tricks. Okay, next up. Now, when the forehead is done well, and hopefully we're going to demonstrate that today, the patients, because we said the frontalis does cause an uplifting effect, patients can sometimes say, oh, my eyebrows feel like they're lifted. They feel like I've had a brow lift. And certainly that is true for a degree of patients. So some patients will certainly say that they get a brow lift or chemical brow lift from just raising up the frontalis or for injecting the frontalis muscle. However, there is something else called the chemical brow lift, which you may have heard of, which involves injecting the brow just underneath the brow itself, which I'll demonstrate in another video later on. Now, there are some patients, unfortunately, who have as much anti-wrinkle treatment or as much chemical brow lifts as they can. It may not necessarily get rid of their hooded brows, and in those situations patients need to have something called a blepharoplasty, which is a surgical procedure to remove the excess skin over the top of the eyelid. So there is a certain degree of benefit from anti-wrinkle treatment, but you need to pick your patients correctly and you need to also set the expectations with them as well. The frown. We all do it, whether consciously, whether subconsciously. In my experience, teachers are the most guilty of this. I often get that patients come in, their teachers, and they say, my students aren't going to know that I'm angry at them. What do I do? They'll have to use the finger, the good old finger. But yes, Ash has got a wonderful frown there. So what we'll need to do is we need to break down what the frown muscles are and what they do, because that will help us to understand where we're injecting and how much we're injecting. The frown itself is made up of a set of muscles, and I'll go through those now. In the middle, this area is called the glabella, which is the skin between the two eyebrows. And in here we can see there's a nice big juicy muscle. That muscle is called the procerus. Now what the procerus does is it pulls in the skin downwards and medially. So it pulls in the skin, creating those 11 lines, or those lines that you tend to see in between the frown. Then from then you've got something called your corrugators. So let's just draw the procerus. Then you've got something called the corrugators. Lovely, you just relax me, Ash. Perfect. So we've got the procerus, which is here, right in the middle of the glabella. Then we've got the head of the corrugator and the tail of the corrugator. Now the corrugator complexes, again, draw in the skin inwards and downwards, creating that frown that we all know. That's it, perfect. It's really important to know whereabouts those muscles actually lie in relation to the skin. For example, the procerus, in front of me, is a big juicy muscle, so we can inject quite deeply in that area, and I tend to inject at a 90-degree angle all the way using a beady syringe with the hole of the needle into the muscle. When it comes to the head of the corrugator, that one is not as deep, Now, we don't want to pass the muscle, so remember we want to inject the product into the muscle rather than going through it all the way. So with this one, I tend to inject at a 45-degree angle with half of the length of the needle going in and then dispersing the product. For the tail of the corrugator, you can actually see here that the muscle tethers onto the skin. And you can see that because you can see there's rippling of the skin at the tail of the corrugator. Now that means that the muscle is very superficial. So we don't need to go in at a 90-degree angle, we don't need to go at a 45-degree angle, we need to go at a 20-degree angle into that muscle, making sure we don't overpass it and overshoot it. We need to get that product exactly where it needs to go. And so in that situation, we do a 20-degree angle into that muscle and going along the corrugator complex. Thank you, Ash. With all of these facial expressions, your muscles tend to tire. So if your patient is feeling exhausted because you've been asking them to frown or act surprised for a long period of time, ask them to take a break and then get them to do the muscle exercise again, because muscles do tire and you can actually lose the shape of the muscle as well. So get them to relax and then frown again. Our model has been great so far. But what about those risks? Well, providing that you're in the right anatomical locations and you're spreading your injections equally along the corrugator complex, you should be okay. However, there are some complications that you need to be aware of. For example, if you place all of your injections too close into the middle of the frown complex itself, you can actually end up getting a bit of a funny eyebrow, which means that your eyebrows are lifted on the side, a bit like Captain Spot from Star Wars. So you don't need to do that, obviously, unless of course the patient likes that and you've got Cookie Lion from Empire and she likes that look, good for her, then that's entirely your call. However, if you did end up with that issue, you can just pop a little bit of anti-wrinkle treatment product into the lateral aspect of the brow just to relax it down so that it looks a bit normal again. Similarly, if you're injecting too low or if you're injecting into the wrong area, you have to be really mindful of that diffusion rate. For example, if I was to inject over here, and I'm really quite low, what can happen sometimes is because you've got maybe a 1 or 2 centimeter diffusion rate, it can actually spread into the surrounding muscles and it can actually end up on the eyelid, and that can cause the eyelid to drop. Again, these are all complications that are reversible in the sense that they will wear off as time goes on, but it's not aesthetically desirable for patients. But it is important that if it does happen to you, don't panic, own up to it, say, yes, unfortunately, it did diffuse into the wrong area and it's just hit the wrong muscle. But the good news is it will get better. And generally speaking, it may take a couple of weeks for that to get better. And hopefully the patient will be forgiving for that because you've taken the time to discuss it with them.